Hello, my name is Frances Frosto, and I've created this podcast to introduce to you the post-traumatic stress disorder, also known as PTSD. I would like to point out that PTSD is classified as one of the anxiety disorders, and anxiety can be defined as a nervous disorder marked by excessive uneasiness and apprehension, typically with compulsive behavior or panic attacks. The fourth edition of the Diagnostic and Statistical Manual, the manual used to classify mental disorders, lists PTSD as one of the 6 principal categories under anxiety disorders. Over 25% of Americans experience an anxiety disorder during their lifetime, and most of these individuals remain untreated. And an estimated 7.8% of Americans will experience PTSD at some point in their lives. PTSD is usually triggered by a life-threatening traumatic event, which can range from witnessing a fatality to a serious accident one may have been involved in. Some common triggers include natural disasters like Hurricane Katrina in 2005, physical assault, terrorist attacks like 9/11, serious accidents like motor vehicle ones, and involvement in military combat. After such events, one can show signs and symptoms of PTSD, such as reliving the trauma over and over, having bad dreams, staying away from things that triggered the traumatic event, feeling guilt, losing interest in activities such as hobbies they once enjoyed, having a difficult time sleeping, and/or having angry outbursts. In this podcast, I will focus on the emotional processing theory that was developed by Foa and Kozak in 1986. Emotional processing is the process by which accurate information is incorporated into the fear element of the patient that eventually helps modify the associations the patient makes to their fear. The emotional processing theory made it easier to understand anxiety disorders like PTSD and developed effective treatments like prolonged exposure therapy. Emotional processing theory as applied to PTSD suggests that the fear components of trauma survivors with PTSD include 2 negative cognitions that underline the development and maintenance of PTSD. 1, the world is dangerous, and 2, they believe they are incapable of coping with stress. Exposure therapy, as mentioned before, is a set of treatment programs that are commonly used to reduce fear and related emotions such as guilt, common in PTSD. In PTSD, individuals relate the fear associated with the traumatic memory to things that they were used to doing before the traumatic event happened. In other words, normal things that are considered safe. For example, a veteran who avoids driving after experiencing a roadside bomb while deployed. Treatment involved engaging the patient with avoided daily activities and traumatic memory to break down and override the connections they made to fear. This allows the patient to form new thoughts that are not associated with their fear to the traumatic memory, thus reducing thoughts of incompetence and thinking the world is dangerous. There are 2 ways of accomplishing prolonged exposure therapy. The first is in vivo exposure, which involves the patient to repeatedly engage in activities that are avoided because of the trauma but are not actually dangerous. This helps the patient over time to cope effectively even when distressed. The second is imaginal exposure, which involves the patient to recall and describe the trauma out loud. This is recorded for playback, which allows him or her to activate their thoughts and emotions associated with the trauma. The recording is then listened to between therapy sessions, maximizing its therapeutic value, allowing them to cope with distress. According to a study that was done by the Department of Veterans Affairs, concluded that prolonged exposure therapy significantly reduced PTSD symptoms among male and female veterans of all war eras, with combat and non-combat related to PTSD. The study evaluated 1,931 veterans from various war involvement after completing a 4-day prolonged exposure training workshop. To sum it all up, PTSD is a serious disorder that should not go unnoticed. In fact, in the last 10 years, research has progressed, and hopefully in the near future, researchers will make it possible to predict who is likely to get PTSD and how to prevent it. It is crucial for PTSD patients to become aware of the signs and symptoms that accompany this disorder, because there is therapy and people out there that can help. Thank you for listening.
Created using Powtoon.